Well, hello, everyone. This is the final lecture out of this chapter on therapies. If you are starting with this one or you have other lectures within the therapies chapter that you have not watched yet or taken notes over, you might want to cover them before you get into this one. Because now I want to get into biological therapies. Let me say this right up front. There are two types of therapies worth noting. And one is psychotherapy, and the other is what we call biological therapies. Everything that you really need to watch before this one is considered psychotherapy and the different types: cognitive, behavioral, psychoanalytical, group therapy, and so on and so forth. The biological therapy is obviously a little bit different because it uses medications as a form of treatment, all right? And not only medication, but we'll talk about some other techniques as well. Know this about biological therapies. For the longest time, and I do mean a long time, centuries, if you had someone who was suffering from mental health issues, the best you could do is either house them in your own home. You hear the stories of the crazy old uncle in the basement or the nutty old aunt living in the attic because you didn't know where else to put them. Up until about the 1950s, that was the case, that you have to institutionalize or keep someone around. There was really no better way to treat them. Starting about 1950, at that point, the height of the number of people in mental institutions was 577,000 as of 1950. And that is an awful lot of people, considering that the population in 1950 was much, much smaller than it is now. Okay? As of 2010, the most recent statistics that we have, less than 70,000 people are currently housed in some type of mental health institution, all right? So the numbers dropped by 500,000 in a little over 50, 60 years. And the reason that is because of the introduction of medications. Now, the study of and the use of medications to treat abnormal behavior or unhealthy behavior, excuse me, is what we call psychopharmacology. Okay, there's a term for you, a bit of a tongue twister, psychopharmacology. Okay, the scientific study of behavior, in this case, abnormal behavior, through the use of medications and a biological approach. There are a number of different types of biological therapies, drug-based therapies. And I'm not going to spend a lot of time on each one of these. We could get into which neurotransmitters are affected. We could talk about the different types of meds. I don't want to get into all of that. I just want to go over the general concept of each, what it does, and maybe even a few of the side effects. The first one I want to mention here is what is called antipsychotic medications or antipsychotic drugs. Drugs such as these are designed to basically treat things such as delusions, hallucinations, and any other form of psychosis out there. If you have someone, for example, who's suffering from, say, schizophrenia, and they get to the point that their schizophrenia is so severe they are having hallucinations, that the voices in their head tell them, and this has happened before, the voices in their head that they're hearing basically turn around and tell them, don't listen to the therapist anymore, don't listen to the psychiatrist anymore, don't listen to the clinical psychologist anymore, and so they do that. You know, they sit down one-on-one with a psychologist or psychiatrist, and sometimes I understand have outright said it. You know, they're telling me not to listen to you, you know, and so they don't. This is where the introduction of antipsychotic medications come into play, because they can obviously do a great deal of help in getting people to not hear the voices, not suffer from the hallucinations, not have to deal with delusions and things like that, and therefore are more susceptible to therapy to get them headed in the right direction. Now, there are a number of different medications. There's neuroleptics is one of the main categories, and then there is atypical neuroleptics. Each has its plus and minus. I'm not going to get into the different types of drugs. I just want you to know that antipsychotic medications are used for people suffering from psychoses, where they're not in touch with reality, And we're trying to take away those hallucinations and delusions to make therapy more effective. One of the biggest drawbacks of a lot of these medications is tremors, muscular tremors. And there is something, I don't have it listed here on the slide, but you might want to make sure you read it in the textbook, is what is called tardive dyskinesia. Tardive dyskinesia is a byproduct of antipsychotic medications. It's uncontrollable movements, muscular movements, and tremors. And sometimes it can involve muscular movements of the mouth and the face and things of that sort that happen, and they're the trade-off. They happen because of the introduction of meds. A lot of individuals who are suffering from, say, schizophrenia, depending upon its level and severity, may not be able to ever go off their meds. They may be on them for life. And so these kind of muscular tremors might become something they have to deal with. And I believe that even if you are fortunate enough to be taken off the meds, sometime these muscular tremors will continue for a very long time, if not for the rest of one's life. So uncontrollable muscular tremors of mild or moderate or severe categories are sometimes the trade-off for antipsychotic meds. There is what we call antidepressants. And just as the name states, antidepressant medications are medications that turn around and basically allow an individual to deal better with the depression. Or in other words, if a person is so depressed, that they are crying constantly, they have absolutely no energy, and things of that sort, that therapy does no good. It's very ineffective at this time. Antidepressants are designed to bring people out of the depths of their depression up to a level where psychotherapy can be more effective. And that's why a lot of these biomedical or biological therapies are used in concert with psychotherapies. Okay? Now, there are different types of antidepressants. And once again, we could talk about MAO inhibitors and tricyclides and SSRIs, and we're not going to get into all of those, okay? There are a number of different side effects that have happened. One of them that a colleague of mine who had to actually start taking antidepressants, and this individual is a counselor, is weight gain. And what was fascinating was this was an individual suffering from severe depression, which seemed to run in the family. And they were put on a set of medications to help deal with their antidepression. And this individual probably went from about a weight of about 150, 160 pounds, this very skinny gentleman, to a weight of about 250 pounds, put on about 100 pounds. And the effect it had on his body is very, very hard to lose this weight. But he no longer had suicidal thoughts. He no longer laid around his house and was unwilling to go into work. All right. And he was a therapist, no less. So he was able to regain his ability to earn a living and do that which he loved. And I asked him once if, weight gain was that much of a problem. And that's pretty much what he told me. He said, "Are you kidding? I'm back to living my life. I've just learned to adjust to it. And so it's not an end all by any means." So know that antidepressants are used for individuals suffering from depression, even bipolar disorders. And there are quite a few different types of antidepressants, all right? And that basically, for the most part, there are actually quite a number of side effects. Weight gain is one of them. Constantly thirsty, dry mouth is another. In some rare cases, anger and rage issues. If these things are happening, depending upon the severity of the side effect, they can change medications. They can try different things. And sometimes that seems very frustrating as a patient to hear a doctor turn around and say, "Let's try this." And that doesn't work. So they go, "Okay, well, let's try that." That doesn't work. Okay, well, and you think to yourself, "Well, I could do this. My goodness gracious, I could become a doctor and just hit and miss." But that's a lot of what it takes. You don't know how the human body will react. And one side effect that happens to one client will not necessarily happen to another. And so you have to adjust for that. Another category that actually is starting to disappear a bit are anti-anxiety drugs. I should say they are not used as much as they were in the past. Anti-anxiety drugs, such as Valium and Xanax and things of that sort, are used to control excessive anxiety, nervousness, worry, and tension. The interesting thing about anti-anxiety drugs is that they can tend to work rather quickly, within hours or less. And I didn't say this before, but let me say it now. Antipsychotic and antidepressant medications have another major drawback, and that is that they can take sometimes weeks to build up in your system to the point that the medication is effective. If you have someone who's suffering from depression, severe depression, you cannot take 2 tablets of something at 9 in the morning and by noon the depression is gone. They might have to take the medication for 2, 3, 4 weeks before it builds up into the system to the level, that it can be helpful. The same is true with antipsychotic medications. You can build it up in the system. That's what it's going to take. And it could be 1, 2, 3, 4 weeks of doing that before it's to the level that it is effective. And so that's some of the drawbacks of antipsychotic and antidepressant drugs. Anti-anxiety drugs are not that way. A person suffering from anxiety can take Valium or Xanax and within a short span of time be feeling much better by, within an hour or two. The biggest problem with anti-anxiety drugs is that they can become addictive. They do have addictive properties, and people can get addicted to anti-anxiety drugs. And so, the body craves the drug after a while. Now you're taking it just so that the body doesn't feel so bad. We are now finding that people suffering from anxiety can actually take certain antidepressants and get the same effect. Okay? Now, once again, it has to build up in the system, but certain antidepressants work well at treating anxiety. Okay? Not that you can take them when you have anxiety and you'll be better in an hour. You might have to take those antidepressants continuously so as to keep these bouts of anxiety from overwhelming you. But really, we're seeing that very few anti-anxiety drugs are being prescribed, and if they are, they're very cautious. As an example, if a person is in a hospital or in a nursing home or in a rehab center, a lot of times they will turn around and prescribe an anti-anxiety drug if needed because it's under the control of the medical staff as opposed to the individual and stuff like that. So in those cases, they may be willing to do anti-anxiety medications, but otherwise they get a little bit nervous about doing so. Now, if all of that sounds a little bit out of the ordinary and a bit extreme, and medications that are addictive and take weeks to work and things like that, here's one you might find that's even more interesting in that regard, and it's what's called electroconvulsive therapy. We used to call this electroconvulsive shock therapy, but we took that name out, that term out. Electroconvulsive therapy is used in the treatment of depression, severe depression. Depression so severe, in fact, that an individual turns around and does not respond well to antidepressant drugs. So with electroconvulsive therapy, as this patient is about to undergo, what they actually do is send an electrical current through the brain. And in so doing, if everything works as it should, this will cause a person to have a seizure. You want the seizure. The seizure is a very good thing because it would seem that the seizure happens to cause an individual to turn around and release into their bloodstream basically endogenous opiates, pain relievers, and stuff like that, which can bring them up to a level that antidepressants can work. So, a lot of times they will do this, and then hopefully within 24 hours they start re-administering antidepressant drugs, bring them up to a level that it can be effective. I have been told that electroconvulsive therapy, if used by itself, will not cure depression. That's why I say you use it to bring it up to a level that the meds are effective. All right? Are there side effects? Yes, to electroconvulsive therapy, but honestly, they're rather mild. One of the biggest ones is memory loss. You're causing a person to have a seizure, and you're almost rebooting the brain in the process. Short-term memory loss, or the inability to form new memories, can and does occur. There are many people that have undergone this procedure that have no memory of the day they had this done. They do not remember. But within a day or 2 or 3, they are doing a lot better. And also, if you don't use antidepressants after one of these treatments, they can fall back into their bout of depression. So that's another thing you need to keep in mind. Finally, is it possible to use too much electricity and cause damage to the brain? Well, yes, that has happened in the past. In the 1940s, 1950s, and 1960s, when we were still learning a lot about electroconvulsive shock therapy, we found that individuals sometimes were administered way too much electricity, which caused brain damage. That really is not possible today. And I kid you not, most of today's technology and the equipment cannot be turned up to a level that would cause that kind of damage. And the reason is simple: liability, legal liability. Doctors in hospitals and other places, the machines just don't go that high, not anywhere close to that high. I've been told that there's probably a chance you'll have to do a treatment 2 or 3 times over the span of a couple of weeks because you can't turn it that high to start with. All right. So if you ever know of someone who has to undergo electroconvulsive therapy, please do not be scared that, the term is their brain is going to be fried and that. Really, that's not the case. And if that one sounds a little bit extreme, here's psychosurgery. Psychosurgery, simply put, is the surgical procedure, a surgical procedure done on the brain so as to alter someone's behavior. Okay? If you remember from class in Chapter 2 on biology and behavior, we talked about the corpus callosum, which connects the 2 hemispheres of the brain. There have been times, because of seizures, that you will cut a person's corpus callosum because they're having seizures so bad that they're unable to do anything. Okay? They can't live their life, as it were. For the most part, okay, that's a form of psychosurgery. Other types of psychosurgery, one of the first ones to come out, was a procedure developed by Egas Moniz. Moniz found that individuals who had very high levels of aggression, could be treated and treated quickly if you could actually do a procedure to cut into their frontal lobe of their brain, the frontal lobe, right under the forehead, so to speak. This is what we call a frontal lobotomy. You can have a patient that at 8, 9, 10 in the morning is so dangerous, so aggressive, that they are a danger to nurses, to doctors, to assistants, and even other patients. And if they were to undergo the psychosurgery known as a frontal lobotomy, and that means they would actually cut into a specific part of the frontal lobe, okay? You don't remove it. If you removed it, it would be a frontal lobectomy. You take it out. Think the term appendectomy. You take out the appendix. Tonsillectomy. You take out the tonsils. With an otomy, you cut into something. With an ectomy, you remove it. With a frontal lobotomy, you cut into a person's frontal lobe. And say an individual who was highly dangerous at 9, 10 in the morning is now, by 2 in the afternoon, purportedly calm as a kitten. Egas Moniz actually received, as I've been told, the Nobel Prize for Medicine for this procedure. It was considered a breakthrough at its time. You could take someone highly aggressive and cure them. But in the long run, basically, it was found out that this procedure did not work as planned. There is a story which has been contested, so I don't know how truthful it is, that Moniz was actually attacked by one of his cured patients. I've read sources that say this did happen, and I've heard other sources that say it did not. But I'll just share it as a legend, if nothing else. That Moniz one time was actually shot in the back by a patient that had been cured. And someone had smuggled in a gun and given it to a patient. Now, this patient did not jump up from their chair in a rage and run across the room and start shooting Moniz when his back was turned. What this patient supposedly did was calmly walk up to Moniz, bury the gun in his back, and pull the trigger. Moniz actually survived. He survived this murder attempt. And people asked, how is it possible that this individual could have done this? I mean, my God, they've been treated. Their aggression is gone. What they realized is that the aggression never went away. It was still there. The frontal lobotomy keeps you from acting on that aggression. It keeps you from bursting into a rage. So what did this patient supposedly do? They calmly went and tried to kill him, and so on. So it's a time. In the end, we learned it didn't really work. Now, there are other techniques, and I think some mentioned in the book, but for the most part, psychosurgery, you know what it is. You know the person that really came up with it. And there are still other procedures out there that can be used. But this is the stuff I want you to know about biological therapies, and I hope that helps. Take care.